So we're pleased today to be announcing that we are investing in several initiatives that will support substantial enhancements for breast health for Saskatchewan women. Improving patient care and wait times is a priority for this government. And we know that receiving earlier screening, diagnosis, and treatment ensures the best possible outcomes for patients. So we're announcing today a few things. First of all, a new breast health center will be opening in Regina to provide a wide variety of services, including diagnostic imaging, specialist consultations, patient education, and navigation to other on-site post-treatment therapies and rehabilitation. When it comes to mammography screening, Saskatchewan will be expanding eligibility to include those aged 40 to 49 in a phased approach. And we will also be implementing an innovative new breast tumor localization technology in both Regina and Saskatoon, which is less painful for patients and as well will also reduce surgical delays and cancellations. Our government is proud of the strides we have made thus far in taking to improve healthcare services for Saskatchewan women. Details regarding the cost implications of these initiatives will be provided within the 2024-25 budget, which will be out in a couple of weeks. I've been meeting with and hearing directly from both Saskatchewan women and also healthcare professionals, such as Dr. Miller here today. And I understand how crucial these initiatives are to patients, but also to healthcare providers. So we're providing today's announcement in advance of the upcoming budget for patients and for family members and healthcare providers who have been waiting for more information from the government. And our hope is that this update today will provide reassurance to patients about our level of commitments to healthcare in this province and to this issue in particular. Not that long ago, our government took some immediate action to reduce diagnostic screening wait times. We announced an initiative in November that people will be familiar with for eligible patients on an urgent wait list for breast cancer diagnosis to receive procedures at a medical facility in Calgary. And I can report that as of February 23rd, 188 patients have been referred, and approximately 131 have already had their diagnostic procedures completed. We're working closely with the Saskatchewan Health Authority to provide additional supports to Regina surgeons who provide breast cancer surgeries to ensure there's capacity to meet the surgical timelines. And I have been talking to some of those surgeons myself personally as well. We're also collaborating with the SHA to increase access to diagnostic breast cancer services, including temporarily expanding breast cancer diagnostic imaging capacity in the cities of Saskatoon and Moose Jaw to support patients from Regina and across southern Saskatchewan. And since late November, we've already redirected about 150 patients from Regina to receive their breast diagnostic procedures in either Saskatoon or Moose Jaw. To improve turnaround times for biopsy results in our major lab centers in Regina and Saskatoon, we're also investing in additional lab resources and technology. This includes additional lab techs as well as technologies to streamline processes and support more patient-friendly services like the new breast tumor localization procedures that we will be doing. We're thankful for the combined efforts of our radiologists, of our surgeons, and our care teams in helping to ensure Saskatchewan patients are receiving urgent diagnostic treatments when they need them. And we're also thankful to our private healthcare teams in helping to accelerate urgent diagnostics until we're able to stabilize these services here in our province. And most importantly, I want to say thank you to the women of this province who I have been meeting with and speaking to, hearing from them through emails and phone calls and letters. We will continue to strive to provide you with the best care possible as quickly as possible. And that is our commitment to you. With that, I would wrap up my opening comments and turn things over to Dr. Sarah Miller.
Should I sneak that over here? Great. Thank you, Minister. This is definitely not how I spend my average Tuesday, so bear with me. Good morning, everybody. I am Dr. Sarah Miller. I'm one of the surgeons here in Regina that provides breast care. I'm absolutely thrilled to be present at this announcement today for the creation of a breast health center in Regina. Quite frankly, when I heard last week, it was very difficult keeping this a secret from my colleagues and my family and friends. This type of service has been lacking in southern Saskatchewan and will undoubtedly make a huge impact in delivering breast care in our province. Breast cancer is far too common. 1 in 8 women will be diagnosed within their lifetimes. and we all recognize the challenges that still exist in our system. I hear it from my patients and their families, and honestly share in their frustrations, anxiety, and concern regarding the present state. Breast care is complex, and these are not simple, straightforward fixes. Though the creation of a breast health center is only one piece of a larger puzzle to ensuring a better patient experience and improving access to care, this represents a tremendous step forward. Last year around this time, I had the pleasure of meeting with Ms. Jamie Hong, Director of Surgical Services and Patient Safety at the Ministry of Health, and Ms. Sandy Ettner, the Saskatchewan Health Authority's Director of Surgical Operative Care in Regina, regarding the potential for pooled referrals for breast cancer care in order to better meet our surgical waitlist targets. This really has ballooned into an extraordinary working group filled with very dedicated and passionate individuals that have spent countless meetings or countless hours in meetings, I think culminating in this announcement today. It has really been wonderful being a part of this group. It's been something that's been very optimistic, and I want to sincerely thank the ministry as well as the SHA for listening to our concerns and continuously working hard to address them. I firmly believe that this center will help with the retention of current breast specialists, aid in the recruitment of these specialists, and most importantly, improve care for our patients. We know that early detection and timely access to care are key for positive outcomes. Again, I'll say I'm so excited about this incredible announcement, and I'm optimistic about the level of care we will provide here in Southern Saskatchewan with the aid of this center. I greatly thank the Ministry of Health and the Government of Saskatchewan for this investment in women's health today. Thank you.
Well, good morning, everyone, and I am so pleased to be here today for this announcement, which will greatly improve patient access and care for the much-needed breast health services. We know improving early detection of breast cancer and reducing wait time for diagnosis and treatment. Now, this is vital for ensuring better outcomes for our patients. To me, this is personal. Having a new dedicated space in Regina to coordinate breast care from diagnostic imaging to post-treatment therapies encompasses best practices, serves as a model for cancer care within our province. Now, the ability for a physician or a nurse practitioner to direct a referral to this center so patients can receive the care and treatment they need to help reduce wait times, delay during a very stressful time for patients and for their families. How investing in new technology for breast tumor localization is also a major step forward in providing a more comfortable, and I can guarantee, a more comfortable, safe, and efficient approach for patients. Thank you for the patients, for women in our province that need this treatment. I'm also pleased to see over 100 patients have received urgent diagnostic procedures they needed in Calgary, as we work on getting the resources in place to provide this care within our province. As I said, as a breast cancer survivor and the minister responsible for the status of women, I am so pleased by the steps our government is taking to address healthcare needs of Saskatchewan women. And I look forward to our government's continued investment in health services that support women. I'm so proud to be here today among my colleagues, healthcare professionals, to mark what will be the beginning of a very important cornerstone for healthcare in Saskatchewan. Thank you.
Thank you. And with that, we'll open up for questions.
Minister, can you just explain how this new center will work?
Yeah, so we have a breast health center in Saskatoon currently, and it would be modeled very similar off of that particular center. And again, I think having it as a focal point for where this is provided, all these services are coordinated and provided out of. That was one of the things I heard from patients, from Saskatchewan women, people who were contacting me to say, we have some, and we do have excellent healthcare teams in this province that are providing the service. People like Dr. Miller here, of course, here today. But but sometimes what we need to do is better coordinate and have just better coordination amongst the healthcare services we do have. I think that center will definitely help in that regard, having a focus center for breast health here for not just for Regina, but for patients in southern Saskatchewan. So I think that's key. I don't know, Dr. Miller, you have some experience obviously with the system, but perhaps you can talk a bit more about the pathways and coordination and how beneficial that will be.
Yeah, I think a really good way to look at breast care right now, the way it's performed in southern Saskatchewan, it's very siloed. So it's really a patient will either have screening mammography or symptoms that require a diagnostic mammography that needs to be ordered by your family physician or your nurse practitioner. Then that will lead to a biopsy, which is the breast assessment center, again, another referral. And then based on that, another referral to a general surgeon. So it's a very, again, I say a siloed approach because once they're with My Care, they're really in that one location. And so having something where it streamlines that whole process, hopefully improving communication in the meantime, because I think we can all speak to the worst part about a cancer diagnosis is the wait, not having a plan, not knowing what's happening. So with the aid of a breast center, again, with having a centralized service, we hopefully can provide wait time estimates and also give patients updates. Well, this is where you are in this process. So instead of saying, well, you've had the diagnostic mammography and now you need to be referred for a biopsy, well, we're going to take care of that automatically for you. Oh, now you need to see a surgeon. Again, that's going to go into a pooled service, so you're going to get the fastest access possible.
I mean, Dr. Miller, just a question for you. What's it like right now being a surgeon dealing with, I guess, some of these surgical backlogs, these long wait times right now?
It's very challenging. And so, the one thing that we looked at last fall when we started looking at this in particular was access to biopsy services. And so that was actually something that came out of our working group, and our radiologists asked, well, we need help. We need to send these women somewhere where they can access these services. So that part has been great, that we're finally getting patients coming back a little bit faster with that workup. Again, it's still a challenge, but at least from the operative standpoint, the SHA has been extraordinarily supportive with that I've been provided more than ample OR time to actually meet my wait list targets, which is how it should be, really. And hopefully it'll continue that way as well.
Is there any concern about having enough physicians to staff this facility?
Yeah, you know what, I think, and that's why, we're making the announcement today. We'll talk more about just the funding of it and the staffing of it, I think, come budget. As you know, there are HHR challenges in the healthcare system, that we acknowledge, but, this is pretty important. We're working to recruit 5 radiologists to provide the advanced breast imaging and breast biopsy services in Regina. That's the vacancies we're trying to fill right now, and also build the program. But we're committed to making sure that, as part of filling those vacancies, but having this breast health center operational, that it is fully staffed. And I think it can't be understated enough, and Dr. Miller talked a little bit about it in her remarks as well. And we discussed this last week, actually, when we met, and I know she had mentioned this as well when meeting with ministry officials and as part of some of the working group discussions that were had, but the importance that this announcement will have around recruitment and retention. And I think Dr. Miller talked about that, how this really does send a signal of the government's commitment to this issue and how important of a priority this is for us. And I think, again, sends a signal across the healthcare sector that this is something that is going to be a key focus for us as a government, to make sure that we are reducing these waiting times, making sure that Saskatchewan women are able to get the treatment that they need when they need it, close to home, which is what ultimately they need to be getting. So we will have our teams fully engaged to make sure that we're recruiting both through the SHA, the Sask Health Recruitment Agency, to make sure that we have all the staff we need there to make sure this place is operational fully.
Can I add one thing to that?
Yeah, for sure.
Okay.
Of course.
Again, not knowing how this works
Yeah.
normally.
Add whatever you want.
So I think a big thing about this as well is that, if you have, personally, I'm not fellowship trained in breast surgery. This is something that I'm personally interested in, and you don't need to be fellowship trained. But when you have individuals that you're trying to recruit that have worked in a breast health center, to try and recruit them to a city and say, we don't actually have a breast center, but please come. It makes it very challenging because there's a lot that happens within a breast care center that really facilitates a physician's role. And I think that's why having this initiative and getting this built will help significantly with that again, recruitment and not only retention of our current specialists providing this care. Because right now it's challenging to provide in terms of how much administrative work we do in terms of trying to find reports, trying to find biopsy results, trying to find imaging, addendums, et cetera. That's a lot what we do, whereas at a breast health center, that's sort of streamlined and all taken care of.
How many women do you anticipate treating in that new center?
That's a great question. I don't think we, as we, determine sort of what, what it's going to look like, we'll determine capacity and staffing there. So we'll have more details coming out as we announce it in the budget in terms of what the actual funding will be, and we'll be able to share a bit more details about capacity and that going forward.
Perfect. And how many women are currently treating in Calgary clinics?
Through the temporary initiative for diagnostics? Yeah, so I think we had 100 and, what was the number I gave? 188, I think, that have been referred there, and 150-ish roughly that have received their diagnosis and treatments thus far. Yeah, and I would say even over and above that, there's been, obviously even more women who've been contacted. Some have been contacted by our teams, but for a variety of reasons aren't able to accept the offer to go to Calgary, and that's completely understandable. But by having these, the patients that are able to accept the offer and get their diagnostics done in Calgary, whatever else needs to be done, that does obviously kind of bump up these other patients who are still back here in Saskatchewan and frees up waiting room time there as well.
Perfect. And do you have a plan to recruit more doctors and nurses to treat these women?
For sure, yeah. It's part of our very aggressive HHR action plan to make sure that we're recruiting more colleagues to be alongside with Dr. Miller and her team, both from the surgeon's perspective, the nurses that we need. I talked a little bit in my remarks today about some of the investments into the labs, because once the biopsies are done, they have to be read, right? And so you have to have the staff, medical radiation techs. You've seen us as a government expand work and invest and expanding more of our training seats. We're training more of those types of healthcare providers here at home. But and that's why it's important that that myself as the minister and Laura as the minister of the Office of the Status of Women, why we have these meetings with people like Dr. Miller to hear from frontline healthcare providers, but also patients, but from frontline healthcare providers to say, what else what can we do as a government to help support you and your team to make sure that what you're doing when this comes to this very, very important care being delivered, how do we best support you so that you can treat your patients? What else do you need? And these conversations, even though we're making this announcement today, and I think this isn't the end of it. We're going to keep working at this, and we're going to continue to build everything that we can when it comes to women's health care in this province. And the conversations with folks like Dr. Miller will continue to make sure that they have what they need to do what they need to be able to do.
Some people have voiced their sort of lack of clarity and confusion around the process of actually going to Calgary. It's process is very confusing.
Yeah.
So you spoke a bit about how this process or this new center would streamline that.
Yeah.
Could you sort of explain to them, to someone who's like, I don't understand what this is, how will this help me, where do I need to go? Could you explain how that would affect your life?
For sure, yeah, and I think Dr. Miller did an excellent job earlier here in the scrum of explaining exactly how that breast health center would work. Again, on the Calgary initiative, and this is a temporary contractual obligation or a relationship that we have with them just in the short term, while we continue to try to fill the vacancies for radiologists and build up what we have here in Regina and southern Saskatchewan. When I've had those concerns raised with me, which I have, we've had our officials check into them further just to make sure, is there anything else that we can be doing in terms of talking to our provider in Calgary, just to make sure that this is as seamless as possible for patients. And I think just to Dr. Miller's comments earlier, that's the significance of having an actual breast health center here in Regina, like we kind of have, we do have in Saskatoon already, but the significance of both from she spoke to, a recruitment initiative for when you're trying to recruit these very specialized healthcare providers, but I think for patients themselves, so that they shouldn't have to navigate the system. It's a very, as Laura spoke about, it's very challenging to say at the least. It's extremely stressful for women when they get diagnosed, and so we need to do whatever we can to make sure that pathway is let out for them. They don't have to source out, what's the next step in my recovery, in my treatment, in my recovery, what happens next, and to try to eliminate some of the uncertainty that comes along with cancer. So that'll be the ultimate goal of the breast health center, is to make sure that it is a place where women can go and get the answers they need when they need them, and be supported by the healthcare teams.
I'm just wondering, how many, I know there's been a shortage of surgeons specifically in Regina, and I think even in Saskatchewan, so how many have been hired and are working right now?
On this, specifically in this area. So we have a couple of updates. First of all, the SHA tells me that additional surgeons with breast cancer specialty have been recruited for Regina, expected to start in July. So that work is happening. In the meantime, I understand that contracts have also been signed with 3 local general surgeons who will have agreed to increase their breast consultations and treatments. And in addition to that, so these contracts allow them to make breast cancer patients a priority. That's essentially what that does. In addition to that, this is part of a pooled referral process. We also have, it's my understanding, a couple of surgeons from Moose Jaw who have indicated a willingness to also join the pooled referrals for the Regina area, and will participate in this as well. So expanding on what we have already for existing surgical capacity with the surgeons that we do have in the system, but some new hires coming on very soon.
Just want some clarity on that. The ones that are starting in July, is that the 3 local contractors?
No, I believe those are 2 separate things.
Okay, so
Yeah.
how many are starting in July?
we don't have the details, because I think they're still working on signing contracts with those surgeons, so we don't have the actual numbers yet, but once we have that firmed up, we'll be able to provide that.
And what's the average wait right now to get a scan?
I'm not sure what the average wait would be at this current, moment in time. I would say just, overall, this is something that obviously we've been trying to focus on for the past number of weeks and months. Again, we need to get the wait times down to the levels where they need to be, where patients are able to get the care within the time frames that are required by surgeons like Dr. Miller and by the healthcare team. So we continue to work very aggressively to make sure that we are staffing up, hiring the people that we need, so that we can reduce the wait times to where they need to be.
And sorry, what's the average surgical time?
I'm not sure I'd have to get that to you, Jeremy. Yeah, we can get that to you after.
I can say from a surgical standpoint, so as part of that, our goal is to see women within 2 weeks. So that's provided you have all of the information you need. I think this is where, again, breast care is so complex that you need a lot of information before seeing a patient in order to provide an appropriate, treatment algorithm for them. So that is what can delay things of, we need that addendum to a report. We need that pathology report. We need X, Y, Z, and I won't get into the details of that. But our goal is, once we have that, usually women are being seen within about 1 to 2 weeks. And then our surgical goal is within 3 weeks for biopsy-proven cancers. And thankfully, again, the SHA has been very supportive of that and ensuring that we are getting that operative time, because as everybody knows, we also have anesthetic shortages or anesthesia shortages. So for slowdowns, again, priority has been placed on cancer care and making sure surgeons that are providing that actually get that time.
Minister Ross, I know this is an issue that kind of hits close to home for you, and I'm wondering if you can chat a little bit about why it's so important for women in positions of power to advocate for women's health.
That's exactly, well, thank you so much for that question, because that's exactly why I am so proud to be the minister responsible for the status of women. And I'll always stand up and advocate very strongly on behalf of women. This is so needed. When I was diagnosed, and it was, well, first off, it just, your world stops. And the seamlessness of what we're going to be able to experience here is going to be life-changing for everyone who has ever been diagnosed. And I come from a family of 5 children, 4 girls. My oldest sister was diagnosed 15 years ago, and I was diagnosed 2 years ago. So I phoned my other 2 sisters. I said, you go get a mammogram. Guess what? Both of them have breast cancer. Now my nieces are falling. So genetically, we're predisposed. But this is why this kind of facility is going to be so important. And that's why I have been championing this with our Minister of Health, who really understands, and you've been there too. So this is why it's so important that women's health be really addressed in this kind of manner.
Minister Hindley, this is something that's gotten the spotlight in the news with women advocating for themselves in the last number of months. But Dr. Miller said, and you said, that this has kind of been happening even before that discussions have been. So was there a turning point? Was there something that you saw or the government saw, the SHA saw, that said, hey, we really need to attack this, specifically in Regina, because there's a developing issue. We're not meeting our requirements here?
Yeah, great question, Adam. And I think, as Dr. Miller talked about some of the work that's been done previously, and this is always something that, we as a government have been continuing to build capacity right across the healthcare system, right? And that includes in cancer care. And it's always a work in progress. So there has been work that's taken place, investments that are made into organizations like the Saskatchewan Cancer Agency in previous budgets, and it's always a significant focus for us. And I think, as you said, this has been very much in the news in particular. But if there was a turning point, I don't know if you want to call it that, but definitely a significant moment in time where there was a significant period of amount of concern. Is as the wait times ballooned and got to where they shouldn't be. Again, understanding the reasons for it, health HR challenges, health resource challenges, not just in Saskatchewan, other provinces, other jurisdictions are seeing it as well. We need to be training more, hiring more, recruiting more, doing everything we can to retain the healthcare providers that we have. But when we were starting to see the wait times that we were seeing, that's where we really needed to double down on our efforts too. And again, this is where we talk to healthcare providers to say, we know what the medium to long-term solutions are, and we're working towards some of these things, such as hiring more of the specially trained radiologists, such as the potential for a breast health center right here in Regina, like we have in Saskatoon. But what can we do immediately? And that's where, as an example, the temporary initiative with Calgary came about as a suggestion from the local healthcare teams here as something that be done rather quickly. But I think that's and now that we're at this announcement today, there's still more work to do. This isn't the end of the line by any stretch of the imagination. We need to make sure that we move this ahead as quickly as we can. We'll talk about more details in the budget about what it's going to cost and what it's going to look like, the staffing ratio, how many patients it'll be able to handle. But you'll see us continue to make additional investments into this very important area for Saskatchewan women.
And do you think, and this would be Dr. Miller as well, that increasing capacity to do diagnostics, getting more people in a breast assessment center will increase the need to treat patients? You're finding out more people may have, a lump or cancer. That might increase the workload and the amount of people you need to staff those places. So do you anticipate that happening, that once this opens and there is more capacity to do more scans, that this may increase the number of the strain on the system?
That's a really great question, because that actually came up when we said, well, this is the amount of women that we have that are waiting for a biopsy. Are we prepared for a surge? And thankfully, we've been able to manage that. I feel like myself and my colleagues, with the numbers that we have, we've been able to do that. I always say there's always the chance that, yes, you might need a biopsy, but not all of them are going to be malignant. Not all of them are going to need surgery. Some may require it, some may not. But again, I think if you streamline this process, we're facilitating, like again, if I'm not spending time trying to track down results on an eHealth viewer and trying to look every day to say, have they had their biopsy, have they had their biopsy? That's going to free up a lot more time where I can have with a patient. Consultations right now for breast cancer care, for myself, they take anywhere from 40 minutes to an hour. When we have somebody like a nurse navigator in our program, not only can that help with some of the information and educational piece for patients, that I can have my time better spent with the patient in discussing XYZ versus something that the nurse navigator can have with them. I think, again, that's just going to build efficiencies into the program, because right now it's very much a patchwork way of providing care. And so I think with this, I think our capacity will be very reasonable. And then Minister Hindley, I almost called you Dr. Hindley. Minister Hindley also spoke about, ensuring that for our rural colleagues that want to provide this care, and for patients that want to stay at their home hospitals, having them do that, right? I think it's an education process for our referring providers to say, here are these individuals that are willing to provide this care. When we talk about the seed localization, that's going to facilitate that. So again, it's not only building capacity necessarily here in Regina, but in southern Saskatchewan in general.
How much it will be, the cost, the total cost?
We don't have the information yet. We'll talk about it at the budget time. Yeah, yeah. I'll provide the full costing of it at budget, on budget day.
Sorry if I missed this, but can you give any timelines at all as far as construction or operation, or if that also good?
Yeah, that'll come out, yeah, a little bit later this year, yeah.
And I'm just curious about a timeline for when you see no longer needing to use the private clinic in Calgary. When do you expect that?
Yeah, so on that one, what we have is we have an arrangement with them until the end of March of next year. That's what we have the funding up to $2 million is what that amount is. So it all depends. We just want to make sure that we'll keep using that service within that, within the contract, what we have set aside there, until we're, I think, in a comfortable position where we think that we have, or achieved what we need to achieve to get people, acceptable wait times here in the province, because ultimately that's what we need to be doing is people, we should be able to get that here either in Regina, in southern Saskatchewan, or in Saskatoon for the central and northern part of the province, but we needed to have it within those acceptable time, wait time limits. So we'll keep utilizing Calgary until we're in a better spot here.
Maybe a question for Dr. Miller, but anyone can jump at it. The technology was implemented.
Yeah.
Explain what that is.
That is not Dr. Hindley, but Dr.
So presently right now, just as a bit of a background context. So if you have something with diagnostic mammography and it's an area of concern, but you can't feel it, at the time you'll get your biopsy, you'll usually have a biopsy marker placed. So that gets that placed, and down the road, when you come to an OR, if you're getting a lumpectomy or breast conserving therapy, because we can't feel it, we have to put a wire in. And that's where we're speaking to the comfort. And so the wire, literally, the way I describe it to my patients, I don't golf, but I use a golf analogy. Just like the flag marks the hole, the wire marks the area where we're going to be excising this. And so with the seed localization, that takes the wire out of question entirely. And so for women, when they're coming for their breast cancer surgeries, that morning's a bit of a crazy time, because you're getting an injection from nuclear medicine that we do for our staging investigations for what we call a sentinel lymph node biopsy, and you're getting a wire placed. And so as somebody that works at the general hospital, my patient will go to the Pasqua Hospital, figure out parking there, then come to the general hospital, and literally this wire is placed and it's taped down, and you hope, oh my gosh, I hope it doesn't move while I'm while I'm in my car, and then they come see me. So the idea with the seed localization, it takes the wire out of that completely. So at the time of the biopsy, you have a seed placed, and then using different technology, it's a different probe. Basically, the time of your surgery, that seed is already there. So that radiologist has already placed that. You don't have to worry about that the morning of your surgery. And so this is where it's really convenient for our patients that are saying, oh, I want to have my surgery in Moose Jaw. Great, they don't have to have a wire and have that on the highway as they're driving into their hospital. So that's incredibly exciting for us. Surgeons like toys, so I think new technology is very exciting. We'll see how that goes. But it's just going to facilitate that process a lot for our patients, providing access to rural communities because it's already in place. And then conversely, if that radiologist is not being tied up putting a wire, they might be doing another biopsy that day instead. Yeah, and it is used in most breast centers and most major centers already. Yeah.
There you go. Way better than I could have ever explained it. The golf thing makes some sense. Do you want to talk about
I do want to just touch again on the expansion of the breast screening age, the eligibility from 40 to 49. And this will be taking place by January 2025, because this is really important. And I think our physician here did explain that, in fact, we're seeing younger and younger women experiencing breast cancer. And so how do we catch that? this is how we do this and that. So this is a real step forward, and it's also, we're on the leading edge of that because in Western Canada, we're going to be the first province that has lowered the age for having this kind of procedure being undertaken. And like I said, no one should ever take this lightly. And it's how we save lives.
Yeah. 131? 131, okay. That have actually received their, right. Perfect. Thanks.
Perfect, thanks, everybody.
Okay.